Welcome back for part two of our History of Public Health lecture. In our first part, we left off at the end of the Middle Ages, so about 900, and now we're going to pick up as we head into the Renaissance and the Enlightenment, so moving forward into the future. As you can see, if we look at this graph of world population starting in about the year 1000, we had a moderate increase in world population up until about the time of the Industrial Revolution, where it really became an exponential increase over that last couple of centuries. And if you look about 1400, really the only time that we've seen a really significant dip in world population is actually due to an infectious disease. This is the time of the Black Death or the bubonic plague, when we saw dramatic reductions in world population. So really the only time that we've seen that was because of that infectious disease. Other than that, as we look over the course of time, we have seen a pretty consistent increase in world population. When we look into the Middle Ages a little bit more carefully, one of the real hallmarks of this era in terms of public health was the spread of infectious disease. And a lot of this had to do with human migration patterns. We had the Crusades of the church at this point, which involved lots of contact between Eastern and Western civilizations, and we traded diseases back and forth. We saw populations increasing, urban populations increasing, more and more trade between different parts of the world, and people brought their diseases along with them. We didn't know a lot at this time about how diseases spread, but there was this theory that disease was spread by bad smells. And this is called miasma theory, and you'll read a lot more about it as you read the second book we've assigned this semester called The Ghost Map. But basically, this theory supported the concept that you got sick because you smelled things that smelled bad. And if you think about it, logically, it's not completely unrelated to the truth. If you have two glasses of water in front of you and you pick one up and it smells like human waste and you pick the other one up and it doesn't, you probably think you're a little bit more likely to get sick from drinking water from the first glass. Of course, it's not the smell, right? We know it's not the smell that actually gets you sick. It's the things that are causing the smell in the water. But it was the beginning of a concept that disease was caused by something other than irritating some supernatural figures. If you've ever heard the children's nursery rhyme, Ring Around the Rosie, that's associated with this time period with the Black Death or the bubonic plague. Ring Around the Rosie, you'd start by getting a rash, a red rash, a pocket full of posies. A posy would be something that you'd hold in front of your nose that smelled good, maybe an orange or something with spices in it, and that would be what would protect you from the bad smells, right? Ashes, this is because the bodies were burned to help try to control the spread of infection, and we all fall down. Lots and lots of people died. So those are the roots of that nursery rhyme. It goes back to the Black Death. We did see, as the plague spread and other infectious diseases, some beginnings of isolation and quarantine, of keeping sick people separated from healthy people in order to keep that disease from spreading. As we move forward into the Renaissance and the Enlightenment, so the 17th and 18th centuries, we see even more travel, right? Even more contact between different parts of the world. And we see some of the consistent scientific advances in Eastern civilizations making their way back to Western civilizations, things like mathematical developments and the use of the microscope. Another thing that we saw during this time period was increased industry and the urban concentration that came with that, right? More and more people living in the same spaces. And we also see during this time period the beginnings of the scientific method, right? The fact that we pose a theory and then we set up an experiment to see that might support our theory and then observe to see what might happen. So this use of the scientific method to investigate problems is something else that we see here. As part of that search for answers in terms of, especially in terms of health, we started to see some doubts that disease really had anything to do with supernatural powers. And the systematic observation and testing of ideas help people to develop other theories. We also had those mathematical advances that supported it, to be able to do statistical work to support some of the experiments that were being done. And we saw the first epidemiological investigations. Some famous figures associated with the beginnings of epidemiology: Lind, Jenner, and Snow. And you'll be able to read more about them at the conclusion of today's lecture. Moving into the 19th century, the real societal trend here was industrialization. This is more and more people living in cities without really the infrastructure to support them, no way to handle the amount of human waste that was created, and definitely some important trends in disease that went with that. But we also saw the rise of the social reform movement here. That was the first group that really talked about healthy living conditions being important to live a healthy life, and a real focus on starting to provide for healthy environments for children, ways to provide for our elders and the mentally ill in a systematic way. But this whole idea of urban concentration was tightly tied to industrialization and an important influence on health at the time. Now, so shifting from kind of that global focus a little bit more specifically back here to the United States, really parallels the things that we saw in other parts of the world, right? Pre-contact, so before Europeans came to the North American continent, mostly indigenous medicine here, that same idea of traditional and herbal remedies. After contact, so after European settlers began arriving, we saw a really dramatic effect of infectious diseases here. So we talked about people bringing their diseases with them when they went places. When Europeans arrived in North America, the native North Americans didn't have any built-in resistance or immunity to the diseases that they brought with them. And 9 out of every 10 people living in North America at the time, native populations, ended up dying because of those diseases. So really, really dramatic and terrible effects from those infectious diseases. It wasn't isolated to the first peoples here in North America, but also we saw early civilizations that were some early settlements like Roanoke that completely disappeared, and current theories hold that the effect of infectious disease is what we were seeing there. In terms of the beginnings of public health, one of the first things that we saw in the United States was the role of harbor control. If you had a ship coming into your town, and you've seen this before, there was a soldier or a sailor who was coughing and sneezing, and next thing you know, there's some kind of disease running like wildfire through your town. Jurisdictions started asking or forcing sailors to stay out of contact with the general population until they were sure they were healthy. In the 18th century, this is when we started to see that be supported by law. We started seeing again that trend toward increased population without really a lot of options in terms to care for their health. But in the 19th century, now we're really starting to see some legal remedies. We're starting to see health boards for cities, health departments for jurisdictions, and they're starting to take some proactive approaches towards keeping their populations healthy. In the 20th century, this is when we see our first schools of public health. The first one in the United States was founded at Johns Hopkins in 1916. UNLV came along just a little bit later, beginning of the 21st century, in fact. And we saw our basic science, epidemiology, really start to advance. A lot more work on surveillance, collecting data about our populations through agencies like the NIH, which is the oldest health agency in the United States, and then also the CDC and the FDA, which came along in the 1940s. CDC was founded to control malaria in the United States, and actually really successful in terms of infectious disease over the course of the 20th century. And as a matter of fact, as we're approaching the end of the 20th century, people started to have the perspective that public health was done, that there really wasn't a whole lot left to do. If we look at some of the things that public health had accomplished, we've seen widespread use of vaccination and antibiotics to control infectious diseases. We'd seen much better outcomes for women when they became pregnant, and also much better expectations for children in their first year of life. So we saw some dramatic improvements there. We saw the rise of the use of the motor vehicle, rise of death and injuries associated with it, and then because of things like requiring seatbelts and improving the design of motor vehicles, we saw those numbers start to fall as well, at least in terms of miles traveled, if not sheer numbers. We saw occupational safety and health increase. We saw much better food and water quality across the United States. Even things like the addition of fluoride to municipal water supplies were helping to improve dental health. And with all these advances, people were really wondering what would come next for public health. We also saw a shift in terms of financial expectations. Many government health expenditures were actually going towards direct care for people and not the prevention approach that public health advocates. Since then, of course, the very end of the 20th century and beginning of the 21st, we've seen a renewed public interest in prevention and lots more support for public health. We saw the rise of the AIDS pandemic. which made us realize that we didn't actually have infectious disease quite yet under control. We've seen the deliberate spread of infectious diseases through things like bioterrorism, and then also the rise of antibiotic resistance, which is making the antibiotics that we currently have less and less effective against the diseases that affect our lives and lifespans. As we move forward into the 21st century, there's definitely still quite a bit to work on, despite those misconceptions in the late 20th century. We see even more effects from travel. Globalization, you can be anywhere in the world in 24 hours. We have trading partners here in the United States from all over the world. And we talked early on about how people would bring their diseases with them. That continues. Spread of Ebola here actually made it to the shores of the United States a couple of years ago because of the fact that you can get on a plane in a place where there's an outbreak, and then you can continue to spread that disease wherever you arrive. Antibiotic resistance, another important public health challenge that we'll be facing. And then in terms of the ways and the patterns that people get sick, we often see that the heaviest burden of disease is carried by the people with the fewest resources to combat it. We call this health disparities. We've got our major chronic disease epidemics, type 2 diabetes, heart disease, cancer, all of these conditions that we don't have clear answers to. And then even when people have access to care, are they getting the same kinds of care in different parts of the United States? The data tells us that often they are not. So this is what we'll talk about, right? I said at the beginning we needed to talk about where we came from so we could understand where we're headed. Some of the challenges that we're facing are the ones that the field has faced over its entire lifespan, plus some new ones that we need to figure out some solutions for. So over the course of our lecture today, we talked about sources of controversy in the field. We talked about the history of public health, how we started. We really have to understand how a society understands health in order to be able to explain how they consider how they might work with prevention. History of public health here in the United States. I want to make a quick note that we talked through history, but I left out those historical figures. I said I'd get back to them. You are responsible for learning the content of those historical figures, and you'll find the content that you'll need to know following in the slides that follow this wrap-up. I didn't want to take your time to talk through all of them because you can read through them just as carefully, and there's some important information on the first slide about what exactly you should know about those figures. Feel free to reach out with any questions, but make sure that you get a copy of these slides and read through the information that